yeah, it is important not to give up right now when we are so close. But it's also important to focus on the positive piece of this. And I worry that the national narrative on this is very pessimistic when we should be optimistic. 2020, we should be, it was a time to be pessimistic because we didn't have an answer to the virus, and we knew it was going to grow. And so we had to take all of these measures just to try to save as many lives as we could. But what I don't want to happen is I don't want people to hear that nothing's going to change. I don't want people to hear that we're not going to be able to get back to normal, that even if you get your vaccine, you're going to have to keep doing the exact same things that we've been doing for a year, because that's, first of all, it's not going to happen. It's going to discourage people from getting vaccines, and it will encourage people to take their foot off the pedal, right? Because they'll say, well, look, if we're just going to do this forever, then screw it, I'm out, right? And that's what we don't want to happen, and that's why we're messaging this week, again, a message of optimism, a message that with the rate of vaccines that are coming right now, with what we know about vaccines, with the way that cases are coming down, with what we know about partial immunity, with what we're learning potentially about seasonality, with what we know about the way the virus is circulating throughout the state right now, that there is an end in sight. There's both the personal end in sight when you get your vaccine and you get that immunity, and there's a collective end in sight when we have enough vaccine for everybody to take advantage of that. And that's where we are now, and that's the message. Many of us have been right on issues in this pandemic, and many of us have been wrong at different times. If you go back, and I would challenge you to do this, go back in December and look at every single model of this disease, every single expert. I did this. I went back and looked. All of those models showed that this virus and this last wave of the virus would peak in March, and that it would be a significant peak. And then it would slowly, and I mean slowly, start to come down after that. Every single one of those models was not just wrong, it was wrong by magnitudes. Now, it doesn't mean that they're bad people. It doesn't mean that they're bad scientists. It doesn't mean that they don't know what they're doing. It just means that things changed. And for all those reasons that I mentioned earlier, and maybe some others, certainly there's some partial immunity out there, and maybe partial immunity about groups that maybe didn't take it as seriously or couldn't take it as seriously because they were frontline workers or whatever. So there's some partial immunity. There's a whole bunch of people that have been really, really careful, and now we have vaccines coming on. There's probably some seasonality to this. We've got better masks, and we know that they're working. All of those things, more testing and contact tracing, all of those things have proven those models wrong, right? We made other mistakes earlier by not doing masks, by not mandating those earlier, which could have helped and maybe save some lives. And so there is this balancing act, and everyone has a different job to play. Dr. Dunn's job is to assess risk and to be cautious and to share those risk profiles with us, to let us know what we're learning about variants, what we're learning about all these things. And by the way, I would say more good news on the Johnson & Johnson numbers, because they were tested against variants in South Africa, and the numbers were really, really good, and that's the variant I think that people are most worried about. And so there's all this positive news. Yeah, so maybe we don't know 100% that you can't transmit the disease if you've had your vaccine, but we also don't have one shred of evidence that you can. And in fact, all of the evidence that we've seen so far says that you can. And all of those things are telling us that we're underselling, the positivity of what's happening out there. And the fact that vaccines are going up. See, we thought vaccines would be going up at a time when cases were spiking. But we've ended up with the perfect storm. That's usually a bad thing. This is the good side of a perfect storm, whatever that is. The best sunny day possible, where vaccines are peaking and increasing when cases are already going down. And so that's why we're so optimistic. That's why I'm able to say, look, by the end of April or the beginning of May, we will have enough vaccine for every adult in the state of Utah who wants a vaccine, which we anticipate at 75% somewhere in there. And 8 weeks after that, which gives you a chance to get your second dose and get 10 to 14 days beyond that, right? Then, so 8 weeks minimum after that, assuming we're still in a low transmission state in your county, then these go away, if not sooner. That's why we can say that. And we can say that with a pretty high degree of confidence right now. But that doesn't mean, we may be wrong. That could totally change in 2 weeks, just like all of those models were wrong, right? And if it does, then we'll adjust. But it's important. It's important from a mental health aspect. It's important from a behavioral health aspect, and I believe it's important from an epidemiology standpoint to let people know that there is an end in sight, so they'll keep doing this. Because otherwise, they're going to quit now, and we don't want them to quit now when there's still the potential for those outbreaks to happen. So I apologize for taking so much time and pontificating so much, but it's something I'm very passionate about. I'm telling you, I'm not going to be wearing this on the 4th of July, and I'm going to be in a parade somewhere, and you're going to be there covering the parade, and you're going to be really excited, and we're going to put these in the fireworks and blow them up or burn them or something. I don't know what, we're going to do something, but if I'm wrong, then I'll come here and I'll admit that I'm wrong, and that we're going to do something different, and we're going to again do whatever we can to save lives and keep people safe. But the last thing I have to say, there comes a time in a pandemic. My comms team's over here going, "Oh, we're going to have to clean all of this up." The idea of government in a pandemic, I think it's really important philosophically to understand this. When we have a disease that is killing people and has a potential to overwhelm our hospitals. By the way, the Mountain America Expo Center, Southtown, what do we call that? Is that right? Yeah. Guys, we were days away from from taking patients there. Patients who had COVID and could die. We were maybe hours away from our ICUs being overwhelmed and having to use this triage center. And now it's a place where people are getting vaccines. And our ICUs are at the lowest, the lowest place that they've been at since like September, October, somewhere in there. That's how close we are. So government has, during that time, we have an obligation to each other to protect each other. That's why governments exist. And this is one reason that governments exist. And so governments have to make decisions, and we hated every one of those decisions we had to make, but we have to make decisions to protect each other. We have a duty to protect each other. At some point, we're not very good as humans at understanding risk assessment and risk levels. At some point that changes to where now, if you're worried about your risk, it's low enough, then you need to take those precautions, and you need to get a really good mask, and you can wear that mask. We're not going to tell you can't wear a mask. You can wear a mask. I have a sister who has to wear a mask every winter because she has cystic fibrosis, and if she gets the flu, she'll die. And so she has to take those precautions, but everybody doesn't. We have a high earthquake risk in this state, but we don't every day hide under our desk because there could be an earthquake, right? I could wreck in the car tomorrow, but I'm still going to drive. At some point, and we're headed towards that with vaccines, people will have a choice to get a vaccine. People will have a choice to protect themselves. The risk profile is going to change, and we'll have very little spread, we'll have very little hospitalization, and very little death. And at that point then, it's not government's job to step in and mandate and keep everyone safe. When that changes, then it becomes everybody's responsibility to take care of themselves and take those precautions and do the best they can.